Hi, I'm Dr. Sarah Wasserbauer, and today we're talking about scalp micropigmentation, probably a subject that's really near and dear to a lot of your hearts. Let me share my screen with you here, and we can talk about the five components, at least in my opinion, of a great scalp micropigmentation treatment. So these are definitely techniques to lift your SMP to the next level. If you're just starting out on scalp micropigmentation, you've learned that it's not as easy as it looks. And a lot of these things that I talk about are things that after I've made a bunch of mistakes, I kind of feel honor bound to pass along so you guys don't have to make those mistakes and put your patients through what I've already put my patients through. So let's get started. The first thing we should all just acknowledge is that scalp micropigmentation is enjoying a surge of popularity worldwide. Hold on a second. It looks like everything's getting ahead of me. Um, the patients that we do hair transplant on, or patients who don't even have hair transplant, are wanting more density, or at least the appearance of more density. Anyone who has scarring on their scalp is obviously somebody who's coming to a hair surgeon like myself or a scalp micropigmentation practitioner. And people, this didn't happen when I was growing up in the 80s and the 70s, but they had lots of hair there and nobody shaved their head. Well, now it's really cool to shave your head. As a matter of fact, somebody showed me a Fast and Furious poster, the Fast and Furious movies, and they said, don't drive fast, you become bald like these guys. Well, that's the cool look, right? So it's associated with a lot of personal statements. And in order to get that look, particularly if you don't have very great density to begin with, an expert scalp micropigmentation treatment is definitely something that's going to meet their goals. So what patients are doing is unfortunately going to tattoo practitioners, which are kind of everywhere, and few expert scalp micropigmentation practitioner exists. Now, there's more and more every day. People are taking this on as a real niche within the tattoo artist specialty, and I think that that is wonderful. But the number of hair surgeons worldwide who could benefit from this, but who understand the components of a great scalp micropigmentation treatment, are few, and we need to educate those doctors who are on the front lines, even dermatologists, plastic surgeons, who would be able to educate our patient base and develop referral networks so that we can get the best treatments to our patients. And the reason to do this is mostly because if we have poor outcomes all the time, then we're not going to have a very good reputation for our industry. And we want to keep our patients to be the most appropriate, ideal candidates. And we also want to give them the best treatment on top of that. This picture is of, we had left some of the pigment on. I was using a gray pigment. This is one of my very first patients. This did not turn out well. Thank goodness I knew how to remove scalp micropigmentation pigment. But this is one of those areas that, you live and you learn. And I wish that I had more people telling me what the components of a good SMP treatment were before I made these mistakes. So hopefully you won't have to make mistakes like this when you are starting out. All right, so here's my 5 components of great SMP. Number 1, it is shallow and microscopic, okay? Keep it high in the dermis. The second thing, it's color matched throughout the lifetime of the pigment. So you don't want it to change, right? And you want to use the best pigment match for that patient. Number 3, that it looks like hair, not little lines of hair, but that it looks like pointillistic, where the hair enters the scalp hair, or hair on end, very short, okay? Number 4, used in appropriate situations. Obviously, it's kind of a no-brainer, but you'd be surprised. And number 5, comfortable. Scalp micropigmentation does not have to be an uncomfortable procedure. There's a million things that you can do to make this a very comfortable procedure. Whether you're paired in a surgeon's office like myself and my scalp micropigmentation practitioners are, or whether you're out on your own, there's a bunch of different things that you can do to make this comfortable for a patient. So the missing pieces of the SMP puzzle are pretty clear. The most important thing is to keep your scalp micropigmentation depth shallow. So these are micropigmentation dots you can see on my little photo here, courtesy of Dr. Bob Haber, who's over at the Cleveland Clinic. You definitely want to make sure that your equipment and supplies are going to enable you to put a pigment dot. You see this right below the epithelial juncture right here. And you want to make sure that you are choosing the tiniest spot size that you can get away with, and that you're choosing inks and supplies that lend themselves to this. And I'll get more into that later. But it's designed for shallow and consistent microscopic dotting. These little dots of the scalp are what makes it look just beautifully like hair. It does not penetrate deeply. So S&P specific supplies and equipment will achieve these goals without harming your patient. You can actually remove expertly placed scalp micropigmentation, whereas you cannot really easily remove scalp micropigmentation, or pardon me, tattoos of the scalp, that because the depth of the pigment and the types of the pigment don't lend themselves to that. So I'll go into this more later, but in order to choose a machine that is giving you the consistent results that you want to usually avoid the deeper, bigger tattoo needles and the tattoo pigment devices that might have some fluid from the patient coming back into the machine. Obviously, I know pigment needles are usually disposable, but you do need something that's like OR quality if you're going to be doing really high levels of this. You want the body fluid black flow is what you're trying to avoid. You want it to be depth and speed adjustable, especially when you're just starting out. You definitely don't want the pigment to get placed too deep, so you definitely need those scalp micropigmentation needles that will allow you to do this. And I've got some great photos here. Again, photos courtesy of Dr. Bob Haber. This is the S&P pigment placed at just the right spot. And here's the hair shaft right next to it. If you place it too deep, this is tattoo pigment placed too deep. If you place it too deep and you have to remove it later, number one, the sebaceous glands, you can't see it actually on this photo, but the sebaceous glands themselves are going to spread this deeper pigment. And so you're going to end up with a blotchy appearance. And the second thing is, if I want to remove that blotchy appearance, now I'm going to have to go past the hair shaft. Hold on, sorry about that. Now I'm going to have to put my energy from my laser into where the hair shaft is. That's going to absorb the laser light and it might kill the hair. Actually, it will kill the hair. I've done this before. And you have to be very careful. Now with scalp micropigmentation pigment, it's placed so shallowly that you don't have to worry. So now I'm already moving on to my next one. How to choose a needle to achieve shallow microscopic scalp micropigmentation. A 3 micro needle will work. A 1 micro needle, usually for the hairline or if somebody has very fine hair. The depth should be a 0.5 millimeter, 0.5 millimeters. And the dots should not be easily visible to the naked eye. Now, in some cases, people leave the pigment covering the area to achieve better, concentration of the pigment in that little epithelial wound. You should still be able to see some of the scalp when you're done. This shouldn't be a wide blackened area. That's not the objective. But if you use a shallow needle and keep your depth low, or a small diameter needle and keep your depth shallow, mistakes made with these two choices are going to be repairable. You'll be able to erase them using a laser. So you might need some assistance with that depending on how the licensure requirements are in your particular jurisdiction. But mistakes made with these two choices are repairable. And there's other ways to repair hair without laser too, or with scalp micropigmentation. So to keep it shallow and microscopic, definitely use a consistent touch with superior equipment, like I already said. So needles puncture and repuncture the skin thousands of times in order to get the pigment deposited. So a light, consistent touch is really all you need. The needle is going to be, and the machine are going to be doing the work. If you are starting out, do a slow number of repetitions per second initially, because that'll allow you more control. You won't be doing as much damage. Number two, color match to the hair. So hair color is the moving target for scalp micropigmentation because hair comes in different colors and patient's hair changes over time. So, and sometimes your patient, like me, I have actually very, very white hair and I have chosen to color my hair. So if I were to get a scalp micropigmentation, in between hair colorings, you need to have that color matching. So choose a color that will blend. Now, there are some patients or some practitioners out there who have beautiful pigment choices, and it does work very well. And sometimes those pigments are stable, but you have to be cautious because sometimes a pigment is stable and sometimes it's not. As a matter of fact, there's a great saying, when it comes to tattoos, temporary is not temporary and permanent is not permanent. So all of these pigments actually do change over time. What you want is to make sure that they are still color matched to the hair when they change. So choose a great S&P pigment that does not have all of those blue undertones, because traditional common tattoo supplies are gonna spread and become different colors as they fade. So orange and blue are the faded results of traditional brown and black tattoo ink. They don't look normal on a human scalp. The two good options would be a black with a gray base. You could also try temporary inks and see what works for that patient's head. And there's a lot of great S&P pigments to choose from. Most are going to achieve your desired goal for the lighter pigment options by diluting the pigment. And each one of these will have its own pigment dilution chart. You can also, if you're very good at this, you can mix pigments together to get that slight hue of one or the other, but you've got to be very cautious because you don't want brown turning to orange and you don't want black turning to blue, right? So you can dilute black pigment that has a gray base, and that's the key. Look for blacks that have a gray base, dilute them, and they will match most anything. This picture right here is somebody who got a scalp tattoo with tattoo pigment. And I'm not sure whether I have it in this presentation or another, but I did end up having to remove this pigment for this poor patient. He wasn't able to do anything that made this look normal. So he ended up, he told me flat out, I would rather be bald than to have this on my head. So when we had to remove that tattoo pigment, unfortunately, some of his hair went with it. So just be cautious what with giving advice to your patients, and this will go on to patient selection here in just a second. So number 3, you want it to be just like hair. Imitation is definitely the sincerest form of flattery, and we're flattering the hair by imitating it. It's never in a straight line. Hair is never in a straight line. I have to explain this 1,000 times a day to all of my patients here when we're getting a hair transplant. It's never in a straight line. It would look odd. Now, some people shave it into a straight line, and you could probably have that option if that's your style, but you never want to place it in a way that's the only option. Otherwise, it'll look odd. And you never want to place it too low on the forehead or on the frontalis muscle. So when you're doing a hairline for a patient, this is not a hairline lecture, but if you are doing a hairline for a patient with scalp micropigmentation, you have them scrunch up their hairline, or their frontalis muscle here. I can't do it because I have Botox, but you have them look up to the ceiling, and this will scrunch. And where the edge of that muscle is, you can feel it moving. Where the edge of that muscle is, draw a line with like a white eyeliner pencil, and don't ever put pigment on that line. They're going to try and talk you out of it. They're going to want their hairline down to here, which, it just doesn't look right. And when they make facial expressions, people will be disconcerted in talking to them. They'll say, what it is, I don't know what it is about that guy, but something's weird about his appearance, and it's just weird to talk to him. So tell your patients that, because you're trying to save them from making mistakes they don't have actual information to be making. So try and talk your patients out of these really low hairlines. This is actually one that was in my clinic, and it actually looks okay, but it's still on the edge for me. It's straight, it's low. Not sure I would recommend this for everybody. Plus, S&P dots they're layered. Some are slightly look a little bit closer, some look a little bit further away. They're scattered. You certainly don't put the top density of scalp micropigmentation dots on a scalp the very first time that you go through. You would go through it with a light stippled pattern, incorporate it into the surrounding hair, and then you'd go back a second time after that to fill in those areas that need a little bit more density or a little less density, or just provide overall density. So when you talk about incorporating it into the surrounding hair transplant surgeons are actually ideal scalp micropigmentation practitioners, because they know how to place thousands of tiny incisions into a close pattern that looks like hair. And they do it all over the scalp all the time, every day. The chief mistake that hair transplant surgeons, and I'm one of those who made this mistake, is actually placing the pigment dots too closely the very first time out, which is what I just talked about. So this is one of my initial efforts. And it didn't turn out too badly. You're definitely trying to place the scalp micropigmentation. I just keep doing that. The scalp micropigmentation in between the hairs, which I managed to do. I managed to make each one of these little dots look like where the hair is coming out of the scalp. I love this picture because you can really kind of see what a hair on end would look like, and what this little pore where the hair comes out, that's called the os, what that little pore looks like. You want that little dot to look like that little pore. You're not trying to imitate a hair. You're trying to do an optical illusion that gives you the appearance of hair. And so the chief mistake that most hair surgeons make is making it too dense to begin with. And one of the other mistakes that a lot of people make is making little tiny lines. Because hair moves, little tiny lines will never look right. So do an initial low density pass, fill it in with subsequent treatments, and then wait a whole year to do an SMP on a newly transplanted head. You want the hair to grow in so that you don't put more density in one area before the hair grows in, and then it makes it look too dense. Hair grows in a stop and start manner, and sometimes grows in a little bit more on one side than the other. So because that irregular patchy appearance might affect how you apply scalp micropigmentation to the scalp, then you want to make sure that you've got over 90% growth before you make decisions on where to put the scalp micropigmentation. If you do it too early after transplant, and patients are always pushing, they want that right now, they want it all done with, they want it complete so they can just get on with their lives. And I get that. You got to do it right. So you're going to be overcorrecting for when hair comes in later, and then it just looks odd. And if you end up in an area that has less final growth, you won't be able to address that either. So make sure that you slow yourself down, slow your patients down. This is going to be a constant battle that you have, is reining everybody in, because everyone wants that instant gratification. But try to talk them into doing what's right for their hair for the long term, and give it your absolute most aesthetic effort. Because if, after all, you're the one that they're going to be advertising. So we want to make sure that your advertising is actually consistent with your best effort. We want it to be just like hair. You want the hairline to be as natural as possible all over the head. This is actually a nice edge. See how it gets a little bit less density as you feather toward the front. It should be a gradient. Think also that you don't want lines ever. It should be a feathered transition, more like the meadow before the forest starts. The forest doesn't start like a wall. It starts with a little bit at a time, and it I hate to say the word bleeds, but it kind of feathers into the rest of the head. But this is a hairline, but these are also hairlines. So make sure that this, if you're doing a bald patient's head, that this area is just as feathered and transitional as this area is. Sideburns, back, everywhere. Okay. You never end an SMP line. First of all, it shouldn't be a line, but you never end it abruptly. You have to blend it into a gradient. And it should be as imperceptible as possible. Now, this is somebody who had just had theirs done, so you can kind of see it. Number 4, appropriate to the situation. So scalp micropigmentation situations on the top of the head include high contrast patients. Usually, think like an Asian with a lighter skin tone and really dark jet black straight hair. And if they have very little actual hair loss, but they want more density appearance, then scalp micropigmentation is ideal. If you are looking at a patient who's had hair transplant and they really just want a second surgery for density, but they are looking at maybe doing scalp micropigmentation instead, try the scalp micropigmentation. Less risk, less overall cost, less time. So it's more convenient for the patient, and it's removable. So if they don't like it, you can do a surgery on top of it as well. Now you'd probably want to wait until that pigment is actually in place, but it's something that you can do. If you are about to do an initial crown surgery on a patient, or if you've got a doctor who's referring someone to you and the patient is stabilized on medical management, you can put scalp micropigmentation into those areas. Or if the patient is male and having a shaved head. Now, female with a shaved head is totally you can do that. It's totally fine. It's just not as often, which is why I usually say a male. Any female with pattern hair loss, which is basically diffuse hair loss up here with hairline preservation. Now, some males have female pattern hair loss, and they might come to you looking for additional density in these areas. And scarring alopecias, as long as they're inactive, scalp micropigmentation can actually work and work well. You usually want to proceed very cautiously, do a test patch, see what the patient's reaction to the scalp pigment is. But as long as you're going shallow, low and slow, the more quality pigments will not have a reaction and they won't have a flare. Now, if the patient does have a flare, because remember, you can't predict these things, And we don't have a ton of evidence as to whether this will cause a flare or not. There's no causal link established yet. If your patient does have a flare, it might jeopardize the scalp micropigmentation. So you have to talk with them about that. Make sure that they understand the risks of doing it. So this is an appropriate scalp micropigmentation situation. So this gentleman wanted me to do a hair transplant on him. He has very high contrast, but very little actual hair loss. This is just kind of the density that his hair is, and he just wants it overall, dense. So he's actually Asian, and he has that really high contrast between his dark hair and his light scalp. This is another one, is when the top of their head. So unfortunately, I didn't put the picture of the patient before the surgery on here, but there wasn't anything here. All of this is completely transplanted. So a second surgery for density was what he came in talking about. I said, you know what, let's try doing scalp micropigmentation. So this is him after the surgery, 3,300 grafts, and here he is after scalp micropigmentation. There's no additional grafting. You can just see that it just looks much more dense. You can also fill in somebody's crown. This individual wanted to fill in their crown with surgery, and basically we were able to do this with scalp micropigmentation and meet his goals. Now, I do tend to tell people, if you're going to do anything in the crown, make sure that you stabilize that rim, because you don't want this to expand and a little, patch of scalp micropigmentation to exist in the middle, or transplanted hair for that matter, because then you'd look like Ernie from Sesame Street. So you don't want that little, dot or patch of hair in the middle with a moat of blankness around it. So for those patients who are looking at their crowns, definitely advise medical therapy to get them to where they need to be. This is another one. Initial surgery, the patient is male. He's doing the shaved head look. I've got a female patient here, all female pattern hair loss and diffuse hair loss with hairline preservation patients. These are all excellent for scalp micropigmentation. This is one of the scarring alopecia patients that I have. Very severe. You can see this line here. This was a severe CCCA. He had worn a hairpiece for years and wanted to go without the hairpiece, but didn't feel comfortable letting the patches of hair grow back, but felt very comfortable with a nice shaped head doing scalp micropigmentation, and it actually ended up turning out beautifully. If you've got a flat scar, it's very appropriate to try scalp micropigmentation, but it's also very difficult. Scar density varies over the length of the scar, even very nice scars. So here's a patient who tried scalp micropigmentation by a very nice practitioner who's a nurse in my area, and it just didn't turn out as well. Now, this was a test patch, and he did not go back, in her defense. He did not go back to have it reevaluated. He just didn't like it and didn't ever return. But this can be removed with laser, and you can try again. So it's wise to advise your patients this is a process, not just a one-time deal. You can do a little test patch just to see where you're at, and make sure if it's a ropey scar that you don't do scalp micropigmentation immediately. Get them to a dermatologist, have some steroid injections, have it flattened out, figure out what's going on with the scar first before you then move into putting scalp micropigmentation into it. It is important to tell your patients that scalp micropigmentation is an all or nothing proposition. Somebody's calling me over here, ignore that. It's an all or nothing proposition. So if you have little patches of hair on your head, it's going to look odd. So like if you've got one little patch here and nothing over the rest, and you let that grow long, scalp micropigmentation is going to make it look like you shaved the rest of it. It's going to look like an odd little fraternity prank. So as long as you've got diffuse hair loss all over, and I've got a great picture of this right here. So if you've got this patient, it's totally reasonable to fill it in. But if you've got little patches in some places and not in others, then it's just not gonna work out for you. So if you've got no hair to speak of, or it's diffuse all over, scalp micropigmentation is awesome. Once again, bald vertex, somebody who looks like a medieval monk that just has the patch of hair loss back here, even 2 millimeters, it's just not gonna look as right. Or light overall density where you've got pretty much nothing there. The scalp micropigmentation underneath that, you got to have at least in my estimation, about 20 follicular units per square centimeter in order to make it look right, but use your judgment on that. So this is a picture of somebody with scalp micropigmentation behind grafted hair. They're letting their grafted hair, this grafted hair is just sparse. I mean, you can see where, how many, how few grafts they have. And you would have to make a judgment call in this case as to whether scalp micropigmentation would really be what you did. I think we chose to do it. So number 4, appropriate to the situation, definitely give your patients reasonable expectations. If the patients never want to see their scalp again, that is not a reasonable expectation for scalp micropigmentation, because, as the wonderful Bill Rassman says, normal patients have scalp. So if you don't want to see your scalp, then figure out another way to do this. You can use the keratin hair fibers. You can use, there's a million other ways that you can do this, but individual SMP dots should not be visible with the naked eye. They should just be shading the whole area. And not all skin types are going to respond optimally to this. I have a couple of patients who their skin is so oily, we just can't get the scalp micropigmentation to stay, even after several attempts. Dry skin, inflamed skin, anything that's really flaky, the SMP won't go into the scalp well, and it'll blotch or fade. We do 2 sessions roughly 2 weeks apart, and maybe a third session to touch it up if the patient needs it. And we warn them that temporary is not temporary and permanent is not permanent. So you've heard that before. In my practice, we also warn them that maintenance is going to be needed. And I've given them a wide range, 1 to 8 years. Usually my patients who need a shaved head look are going to be coming back and needing maintenance every year. But for some of my female patients who really take very good care of their scalps and wear a hat out and don't really expose their heads to UV light, their scalp micropigmentation, that's why I say 8 years, has lasted a really long time and still looks absolutely fresh and crisp and beautiful. So with all this in mind, your very first ideal candidate, if you're about to try and start this, maybe the tolerant person who's willing to let you experiment on them. Maybe a friend of yours or somebody who's actually in your family. So here's the last one. Keep it comfortable. Comfort is king. Let's reduce the pain for our patients. It should be irritating, but not frankly painful. You can try it for yourself. Have somebody, do it on your head, and let patients feel it before committing. This is part of doing a test patch. So I've got a couple of tactics here for pain control. The more we can make this a comfortable process, the more the whole industry will have a good reputation, and each one of us will rise with the tide if we're all in that same boat. Recline the patient, give them a blanket, give the patient a squeezy rubber ball or something to kind of distract them. Nitrous oxide is excellent for this kind of thing. It's inhaled, it's out of your system in 7.5 minutes. Vibration is also excellent. Every once in a while, I'll take a cold pack and put it on somebody's head, or they'll bring a cold pack with them that they like. Lidocaine foam can be very useful. You do have to leave it on for a certain period of time. So have your patient come in early and then pre-medicate with that. And I find some patients, it just still doesn't take the edge off, and it might alter the ability to put that scalp micropigmentation into the head. But for some people, it works. And then I have a big screen TV right up in front of the patient, and watching movies is a marvelous distraction. So putting it all together, all these components add up to a great scalp micropigmentation treatment. Keep it shallow and microscopic, color match it, through the lifetime of the pigment. Remember, things may fade and patient's hair color may change. Keep it like hair. Use it in appropriate situations and keep your patients comfortable, because all of these together are going to give you, they're going to bring you from an okay scalp micropigmentation to a great scalp micropigmentation, which is what we want everybody to be doing. Just a little bit of practice and concerted effort, and we can all get there together. I hope that helps. See you all later.